Welcome back to Twist of Fate, a small business podcast where you can find your inspiration to make your entrepreneurial journeys come true. Today, we have a special episode in the capital city of Sacramento, where we're here to talk today about healthcare equality, or lack thereof. You see, there are many healthcare disparities in our world today. Whether you live in a developing or emerging economy, there are many individuals or groups that are experiencing a different outcome and overall different patient care in certain circumstances that needs to be addressed. My guest today, Dr. Kim Tranquata from the Healthcare Alliance for an Equitable World, is taking on the fight to bring fair, responsible healthcare that will battle healthcare disparity, screen for any disease conditions that wouldn't be found, and at the end of the day, make the world a better place. Dr. T, welcome to Twist of Fate.
Doug, it's my pleasure to be here. Thank you so much for this wonderful opportunity to talk to you and your audience, and just to be part of a nice conversation with you this morning.
100%. Now, Dr. T, I think something that makes our species, mankind, different in the animal kingdom is that we understand the difference of right and wrong from a moralistic standpoint. But yet, healthcare disparity is a reality. Maybe you could talk a little bit, like, from your viewpoint, why can't we get this right? Again, all political views aside, like, do you see across your medical career, like, why is this happening to us?
Yeah, Doug, this is pervasive. We know that outcomes, even in the most developed healthcare industries in the United States and in Europe, that outcomes for people in lower socioeconomic groups, they have higher mortality, higher morbidity from every condition. And this is certainly the case within the country, and it's the case globally. A lot of it is perspective. Becoming a physician and being in healthcare takes a lot of years of training. And then after all of those years of training, people tend to get concentrated into a few places, a few academic centers that have all the specialties and all the surgeries and all the great gadgets. Yet there's huge parts of the country and huge parts of the world that don't have access to those things. So in my career, I've worked in those academic medical centers. That's where I started. That's where I trained. That's where I went afterwards. And
some great centers, right?
Like absolutely.
Yeah.
And they do great things and they advance science. But then as I progressed in my career, I went out into the community. I work in critical access hospitals. I've worked with the Indian Health Services. And when you're in those places and you have a sick patient that needs something at one of those academic places, it's a huge barrier to try to get that patient to care. The people on the other side of the phone don't have any perspective about why the patient needs it, what you do or don't have. Mm-hmm. And you have to overcome a whole educational thing with everybody you talk to on the other side of the phone while you have a sick patient that you're trying to get transferred somewhere, for instance, for care. And if you take that as a microcosm and then you expand that out into, for instance, nationally in the United States, we have the Indian Health Service. We have the Native American populations. We have people in urban centers that are in healthcare deserts, even though they're in the middle of a city. And we have people in rural areas that can't get to healthcare, transportation, all kinds of barriers. And then the people that can do the care don't have the perspective to understand that.
I appreciate you sharing this. And, as you illustrated, the empirical evidence shows there's healthcare disparity across the board for these groups. But it's a highly personal issue for you because you also experience this. As you mentioned, you're an attending emergency physician, and you've gone to some great academic centers, NYU, right? Yes. SUNY Downstate. Yes. So I would like, if you don't mind, if you could maybe elaborate on how you personally have experienced these healthcare disparities and how you battle them at work. And, I think COVID in particular, and this is where I was going, has, if anything, has been a force multiplier to make these disparities worse, if I'm correct, right?
Absolutely. It has made the disparities worse, but it also has laid them bare for us to see. Prior to COVID, we could always kind of hide and make excuses for why things happened because they didn't happen all the time and at the scale that they happened during COVID. But during COVID, it became very clear where the resources were and where the resources weren't. Mm-hmm. And I can tell you that working in a critical access hospital in the middle of COVID, it is the degree of shift that was visible in this country, where we went from, if a patient needs something and they have a highly trained, appropriate clinician, they can get them that care with the resources. We went from that to there is no place to send the patient. Everything is overwhelmed. I'm sorry. People telling you, medical centers that have the care, I'm sorry, we can't take care of your patient. They have to stay with you and they may have to die with you. That has changed the landscape for physicians and for healthcare in the United States. And we're coming on a third year where we're approaching the same thing. Even though COVID is not the same degree of a health threat to the individual as it was 2 years ago, our healthcare system is already lamed. And the increase in flu, a little bit of COVID, and a little bit of RSV, it's only November and our healthcare systems are already overwhelmed and we're already turning away patients from care. That brings us to a level of care that's unprecedented in my 25-year career, and certainly not what I think the average American expects about what's going to happen when they show up at a hospital.
So healthcare disparity for workers, for patients, even in the developed world and the emerging world, is a clear unmet need you've identified.
Yes.
And you've taken it on yourself to form a healthcare alliance of physicians that are going to take on making healthcare equitable for all.
Yes.
So tell my listeners a little bit more about your unique approach to bringing this coalition together.
Absolutely. So I've been working in the healthcare system for 25 years at various levels of leadership. And I've certainly tried to do what I can within the established healthcare system on a local level, on a regional level, even a national level, to bring initiatives forward to try to help our patients, to bring greater access. And in doing that, I have also been developing what telehealth can do to help increase access to people that are in places where they have transportation issues, where they don't have access to specialty. And I have built programs and built the self-efficacy that comes with knowing that I can do that and seeing the impact that it can actually have on getting people in their homes to care, to specialists. Now, you can't replace in-person care with telehealth care, but you can absolutely augment it, and you can use telehealth to bring the same amount of doctors that you have already doing the work into more places to serve more people. And so this is what's important about entrepreneurship or important about transformative change. You can't make incremental improvements in an overall system and expect transformational change. I believe one of the most powerful ways to make transformational change is, first of all, to have a transformational idea, but to be willing to completely move away from the way things are done. So the idea of Healthcare Alliance for an Equitable World is you get physicians, doctors who, from the beginning of their career, were driven by purpose and mission and wanting to make a difference in the world. They're 3 years into the post-COVID world, and they're feeling like they've lost contact with that mission. Bringing them together, and they are the resource, right, that is needed around the globe, and having those people from their homes without a great barrier to being able to have to travel or spend 6 months somewhere or a year or leave your family or leave your employment, making it accessible to everyone now, every healthcare professional, to be able to go on video or on a phone and provide healthcare across the globe to people that do not have access to healthcare, either because of a specialty need or because they're rural or for a number of reasons. We know that there's a healthcare workforce shortage, not just in the United States where it's in the hundreds of thousands, but globally it's predicted to be in the millions by 2030. We can't make new healthcare workers, but we can use the healthcare workers we have in a more efficient way and give them the ability with telehealth, in addition to their in-person work, as a part of their time, to do work around the globe and serve that need. And what does that bring us, right? That brings us equity, right? And it also helps the healthcare workers themselves have that perspective. Remember, we talked about how I'm trying to transfer to a tertiary care facility. They don't understand what the needs are. When our doctors in Healthcare Alliance are now doing telehealth across the globe, they are learning. They're helping patients, absolutely, but they're getting something back. They're learning about healthcare across the globe, and they're forming a community that can bring best practices now that we can share across the globe.
This is excellent. This is excellence, and you should be commended for your efforts here. For my uninitiated listeners that may not appreciate the difference in self-care and telehealth, maybe we can talk a little bit more about that. So you've chosen to use telehealth, which my understanding is how you can take a physician skilled practicing in Western medicine and using phones, telecommunication tools, you can now communicate outward to whatever parties on the other side. And that doesn't necessarily mean in the United States only. This can be anywhere. And you have built an alliance of physicians that are already doing this, correct?
Yes.
So maybe you could tell a little bit more about the physicians you're working with and the types of, care models that you're providing via telehealth.
Okay. So we're very new, and so we have what we're doing now and what we want to grow into. Right now, what we're doing are small missions. We work with companies that are doing missions within a country where they might be providing healthcare for over a series of days or weeks, and we augment their healthcare workforce by being on telehealth. So if you go to a community, one of the places we've worked is in the Philippines, and you want to help a group of people. We worked with people that go to a local soup kitchen and they recycle during the day to make their living and don't have health care. If you want to help those people and you pull in a group of doctors to work to help do health exams for them and give them health care, you're limited. You only can get so many people through with the number of doctors you can get in place. So what we become is a magnifier. You can have Healthcare Alliance join your on-the-ground group now, and we are able to help you see 2 times, 3 times, 4 times as many patients because we can get doctors from the comfort of their home for shifts of a few hours at a time, multiplied, to come in and help you see those patients. They can just see them parallel, or one of the things they can also do is be the screening point where they can see the patients, and if the patients don't need anything other than a prescription or a consultation or something, take care of that, and then refer the ones that need your in-person care to you to help make your in-person team even more efficient.
Of the physicians that have come forward, because I think what you're talking about, this is could be perceived as volunteerism 3.0. But this is also, you're building it to be a business.
That's true.
And providing care from these bright people, is it that, how have you gone about recruiting or identifying, or to some of my physician listeners there that want to get involved, like, what do you feel is the incentives beyond them obviously wanting to give back from a altruistic standpoint, but there's an angle that you're trying to make the incentives good for them too?
Absolutely. So right now, because the organization is very new, it is volunteer based, and what people are getting is a lot of people have wanted to do this kind of work their whole lives, but it wasn't accessible. So it's accessible volunteer work that's making a global difference. So a lot of people do want to do that, and this makes it accessible to them. Again, only a few hours of a day, and you don't have to have a big commitment. Long term, what we want to build is a 24/7 on-call with an app group of physicians that anyone across the globe, whether it be a healthcare worker in a village that needs assistance, or if it is maybe a healthcare center that the patient can go into to call in. So what we're trying to build is a 24/7 on-call switchboard where people will actually be paid to do this work, shift work essentially. And it could be part of how we provide healthcare globally. You have your in-person job, and then you have your telehealth job. This is the gig economy come to medicine that has been so attractive to so many. But we're not building it because it's attractive and because it's a gig, but because we think it actually will bring meaning to the people doing the work, and because it can make such a big difference in the world.
And you also had mentioned that you've already had some initial experiences improving the quality of care in the Philippines. Are there other countries that are particular targets or areas of interest where there's healthcare disparity that you really want to go after?
Unfortunately, Doug, there's so many places that have healthcare disparities. And so the barrier to doing this work internationally right now is wherever you're doing the work, you have to have licensure or a waiver of licensure from the local government. So most of our work right now is very much targeted to places that have a regulatory framework that's open to letting a physician outside of their own country come in to provide consultative work, at least, to people within their country.
Is that a big group of countries, or is it small? Because to me, why wouldn't you want trained, experienced physicians motivated to help patients? Like, is that a big group or a small group of countries?
It's a big barrier, and it's a big group. Every time something is new, the barriers are there, and you have to break them down one at a time. So you have to build trust. An individual country does not want to have random people coming in and taking care of their patients, because there's a history of people coming in and maybe not being respectful,
Sure.
not treating the people appropriately, bringing their own ideas from their medical system in their country and imposing it. And, you know, our world is full of stories about colonialism and well-meaning people that say things and do something else. So it's really important to us as an organization to understand that that is real, that you can't just say, well, we're nice people, don't you want us to help? That is real. We understand that, we respect that, and we're going to have to build trust one place at a time until our organization really has that understanding and that global trust that we can advance this. And then maybe it becomes something for the future where this model, but telehealth is brand new. It's only because of COVID that in most of these places, any telehealth is taking place, which is only, in its third year.
I agree. I think telehealth at the point of care is new because of COVID. in my past life, I worked with a lot of radiologists that did telehealth, but that was in hospital, like in, right? Like it's not at the point of care. And I think that's really innovative. And look, Dr. T, I have to commend you, my friend. Not everybody's ready to take on healthcare disparity. So one, gold star for you. I'm a fan. I'm curious, like, where does the inspiration or the spark of you wanting to take this on come from? Was it a patient you lost? You were thinking about this for years. You wanted to fight the system. Like, this is almost like fighting the mob, right? Like, it's fascinating and really inspirational that you're doing this. Why don't you talk a little bit about what your twist of fate and what made you want to do this?
Yeah, Doug, I think everything in my life has led to this point. I myself am an immigrant child. I came to this country when I was 7. Lived, the humble beginnings of an immigrant, and the feeling of knowing you're an outsider, and this isn't your country. Even children make that obvious to you, especially if you have an accent or you speak in a different language. I didn't have a language barrier, but my accent made it seem like I had a language barrier. And I've experienced many of the things that people that are discriminated against experience. Certainly it's been better for me than many. But I'm a mother of 3 daughters. 2 of my daughters are adults now.
Congrats, by the way. I have a long way to go before that. My kids are small, so I have a long way to go.
I've experienced all the challenges along the way, and I am at a point in my life where I want to know that I've left the world better for them and for others than where it was when I went through it, and I haven't yet. I look around and so much more needs to be done and so much is the same. With every leadership opportunity you have in life, it comes with a great responsibility. And that responsibility is your greatest reward. I want to take everything that I've hard-earned in my life, and turn it around and try to have the greatest impact for global equity that I can, because I think that's the future. People that are empowered, people that feel valued, people that have dignity, make the world better. They become the next leaders and entrepreneur, and the world cannot get better without equity. So that's where I want to focus my attention.
And it's going to pay it forward in karma, this life or the next. You're going to be favored by many for this. So let's talk about, the path to success for you is going to take an alliance or coalition of physicians, but you've partnered with some great organizations already. Maybe we could talk a little bit about, you mentioned like the missionary organizations or other organizations that have kind of been a portal for you to get your physicians in there. Is there any ones in particular that have been helpful or?
So in a bit of a twist of fate, I was just sitting in my living room on my computer one Saturday morning after I did my jog, and SoMe Docs put out a social media blast that they were having a meeting of entrepreneurs, and please join on Saturday morning. And so I joined the meeting, and they said, look, we're going to do 2-minute pitches. Just pitch your organization.
You knew that about the Healthcare Alliance at that point? You viewed yourself as an entrepreneur.
Absolutely. Actually, Healthcare Alliance was brand new. I had just formed the organization. I had filled out a TEDx application for the TED Fellowship program. So I had done the work to think about the organization and the mission and how we were going to structure it.
Fantastic.
And I went on SoMe Docs, and they were doing these 2-minute pitches, and I thought, boy, I am not ready. I'm in my exercise outfit. I didn't know I was going to do this. Holy cow. And the voice in my head said, you are an entrepreneur. You are a CEO. You have to do this. Your company is relying on you. Mm-hmm. And so I went on, and I did my 2-minute pitch, and afterwards, the woman that runs SoMe Docs, and one of the other doctors listening said, I know someone that you should talk to, Milton Chen, the CEO of VC. I said, cool. So I looked up Milton, and Stanford PhD, and he's
smart guy,
super smart guy, programmer, and has built this telehealth platform that's been used by NASA. And he also has this charitable arm of his company that does missions. And so I was introduced to Milton, the most humble guy in the world, gets on the phone and we have a video chat, and he is so magnanimous. And it's like, it would be really good if you just proved your concept. Come join us on a mission in the Philippines. And I said, great. And so we went and we joined them, and they were able to see what we can do, and we were able to, again, proof of concept, do it and show that it works, and and that was our first corporate partnership.
Fantastic. And I'm going to break the fourth wall and talk to my audience about this one. Dr. T just revealed a very important point. When you're willing to take the initiative, whether you're ready or not, fortune favors the bold. And you will find, as you pitch your ideas and share it in a public forum, there are those out there that will help you. And if you do it right, then they can lead to an official first pilot or partnership where you can do your proof of concept. And that's awesome. And by the way, I want to tell you, I think many of my listeners are aspiring female entrepreneurs, that your bravado and willingness to put yourself out there, and I think even as a physician, to do something that's outside of the realm of what you've studied for 12 years, right? You should be commended for that. So I think that's awesome. So another thing I want to talk to you about, which now that you've had this pilot and great partnership, and you've identified certain countries that have regulatory standards that can help you get in, is as you're going to build to scale, is there a particular emerging diseases or trends in the disparities that you're looking for? For example, I'm a member of the African American community. One of our problems in healthcare is, blood pressure not being identified, diabetes, a lot of the comorbidities, cholesterol. But emerging economies are a little different. Could you talk a little bit about some of the things that you saw in this Philippines pilot of diseases on the rise that we need to address?
Perhaps surprising, among the adult population in the Philippines, diabetes and hypertension are also the most common.
They're eating well.
The same are also the most common diseases. But what we find, and this will vary from areas, is things like pneumonia is the number one killer of children. Other things like intestinal worms, very common. Doesn't kill children, but it makes them malnourished. It causes a number of symptoms, including abdominal pain. And so one of the wonderful things about doing this work is, going back and remembering those things you learned in medical school and you never got to take care of because it didn't happen in this country. But also learning new ways to treat those things that we treat in America by meeting the patient where they are. We can't do all of the things we do with our first world medical system that's based on, increasing billing for somebody that is without access to care. We have to prescribe the cheapest medication. We have to figure out how to get it to them in a way that's sustainable, and how to now stress the things they can do outside of medication because perhaps they can't afford medication long term. How to really stress the things we don't spend a lot of time stressing, like lifestyle change and diet, so that we can help them.
Dr. T, would you mind talking a little bit about, one, what success looks like to you? Because in a lot of cause organizations, I think finding what the key performance indication of success is harder, right? Like, are you looking to curve, like you mentioned screening earlier, find diseases earlier, prevent patients that maybe improve mortality rate? Like, what was success look like in a program for you?
So we are actually looking to target the United Nations Sustainable Development Goals around health. And some of those goals are equity related, making sure that care is equitable for women, making sure that care is equitable for people that are poor. So certainly those are things we're looking at. Making sure that you build the infrastructure in a community around health, and that you train people in a community to be able to do healthcare. So those are the things that we want to do as well in the local communities where we work. And we do that even with the missions, with the people we train. And so that's one of the things we're doing with our very next mission, is starting to collect that data. And so that we can now go to health ministers and say, when we did this, we treated this population of people that is in this socioeconomic class, they're this far away from a medical center, this is how many women and children we took care of, and this is the impact we expect on your sustainable development goals.
That's fantastic. And an area that I would love to talk a little bit about for all of us as entrepreneurs that experience success, there's also challenges. Obstructions, barriers. I'm sure you do. As an emergency physician, you deal with challenges a lot more often that need solutions. There's mortality's tied to it. But if you don't mind, like, is there anything that you've seen since you started your entrepreneurial journey that you regret or you would redo, or like an observation of like, ooh, that's something to watch out for? Because I think for a lot of our listeners that as they're thinking to do bold things like yourself, is there anything that you would recommend that they think about?
I was not just joking. I love challenges. Every challenge is a learning opportunity. And if you're not encountering challenges, then you're probably not doing any real change, because an easy path is the path of the same. But is there anything I regret? I don't think there's an easy way. I don't really have any regrets. I ask myself and really deeply probe before I do anything, what is your motivation? Who are you being? Who are you serving when you do this? And that really keeps me on a path where I don't do things that are regrettable. In general,
I sense that's not your nature to regret things. I just sense that as well.
Daniel Pink wrote this great book called The Power of Regret. And, he looked at studies of regret around the world. And 80% of regret is regret about things you didn't do. And I don't want to be stuck in regret about something I didn't do. So I would say to anybody that's thinking about doing something, and you're gonna face challenges. Every time you face one, say, yes, I am doing something important. That's why a challenge has come up. And what is it trying to teach me? And what can I learn here? And how can I pivot? And I think if you keep that in mind, and you just keep moving in a direction that's based on your values, you have to do the work you can't come into leadership or entrepreneurship without doing the work, knowing your values, knowing how to be authentic, and knowing how to really honor those values in the things you do and say. If you do that, you just keep going.
Fist bump on that, and I'm breaking the fourth wall again. Dr. T just hit a very important point out of the park. The truth is, the greatest regret you'll ever have of having a great idea is not actually going out and implementing it. And expect the challenge, embrace the challenge, take the challenge. These are mantras I live by, so we are on the same page. Now, I met you actually at the American College of Emergency Physicians.
That's a twist of fate.
That was a twist of fate. We met at an evening cocktail party dedicated to SUNY Downstate and Kings County physicians, and many of your colleagues and amazing, passionate people were there. I'm just curious if other people were looking to get in contact with you, if they're interested in joining the Alliance, helping, supporting, blocking and tackling on regulatory, like how would they get in touch with you?
I am very available. HAEW.org. info@HAEW.org is the best way. I read that email every day. I will look at that email every day. I have met a lot of amazing people actually along this journey that are interested in what we do, and I am absolutely really enlivened by the meeting of people who have such amazing passion and amazing levels of specialty and just want to be part of helping create a change. I'm not looking for anybody to work for me. I want people to work with me. And I want us really to form an alliance of people that are sharing ideas, learning from each other, and empowering each other to make a difference.
Dr. T, I really appreciate you coming on Twist of Fate. Let's say this. I hope you prove the naysayers and the skeptics wrong, that there can be a fair and equitable healthcare for all. And with that, I want to move to my final thoughts. You know, it's time for you that's listening to this to get off the bench and in the game. We are not talking about the difference of privatized healthcare or socialized healthcare. Like, this is back to the common denominator of who we are as mankind. We and you know better. We need to make sure that there is quality and fair and equitable healthcare to all. Children, mothers, fathers, no matter where in the world they're born, should get a fair shot at life. That is the American way, and that, my friends, is why I would encourage you to get involved, take a look at the Healthcare Alliance for an Equitable World. It is good for business, it is good for the soul, and it's the right thing to do. I hope you enjoyed this episode of Twist of Fate. Please like, share, and subscribe. We are trying to bring content to you that will help you build your entrepreneurial journey with passion, planning, and optimism. And with that, I look forward to seeing you on the next Twist of Fate.
Twist of Fate is hosted by Doug Younger. It's produced by John Lundford and Matthew Brown at Ezo Creative. Moni Yu designs our graphics, and Enrique Pimentel manages our digital life. Our theme music is by Jamie Bathgate. Special thanks to all of our patrons. You can support the show by visiting patreon.com/twistoffatepodcast. Thanks for listening.